Can you tell me why this report is important? And first, tell me your name and your position and who you are.
I'm Anthony Costello. I'm director of the World Health Organization Department of Maternal, Child and Adolescent Health. This report's very important because midwives are the backbone and heartbeat of many health systems, particularly in poor countries where doctors in remoter areas are hard to find, where midwives do the bulk of the deliveries in facilities, and where midwives provide the support to women out in communities who need safe pregnancy, safe delivery, and safe postnatal care. So midwives do a tremendous amount, yet their voice is often not heard. And this report is about why it isn't heard, some of the constraints on midwifery. Some countries don't even have midwives. And so thinking through how we can change that situation, increase the numbers of midwives, increase the skills of midwives, their voice, their power in decision making, and so that women have the kind of advocates that they need, and also so that we can save lives.
Let's talk about that saving lives component. I was recently in Malawi where we did a citizen journalist training with a group of midwives, and part of that was to really listen to the things that they were already advocating for in their health centers, and lots of lives were saved by these Malawian midwives who had zero resources. What is that? Can you talk a little bit more about how midwives really do impact the bottom line with maternal newborn health, and what all of these global bodies have committed to doing, and how midwives really can make that happen?
Well, the first thing is take any normal birth. If you have someone there you trust, a midwife who's supportive, reassuring, and you know has the basic skills to deliver your baby, that is a therapy in itself. You know, there's one hormone, oxytocin, that controls the way you have your labour and your breast milk coming down afterwards. And that hormone is very affected by stress. So if a woman is isolated or stressed or frightened, it's going to immediately impact on her labour and increase the risk of her having a complication. So even in normal deliveries, for the 80-90% of deliveries that are going to be relatively uneventful, they provide a tremendous amount of support to ensure they stay that way. If there's a problem, then midwives, this report shows it, but many other reports show it, the recent Lancet series on midwifery, that nearly 90% of all the interventions we need to do can be delivered by midwives. Okay, some high-powered surgery is the realm of obstetricians, but most things that you can stop a hemorrhage, stop women bleeding to death, you can treat infection, you can diagnose early one of the complications, you can even do cesarean sections. I mean, not everywhere is that allowed, but nurses can do cesarean sections in an emergency. So, you know, they're the people that we should be supporting, but there are many barriers to this, not least of which is the medical profession. I mean, you know, I'm sitting in the World Health Organization, there are 2 midwives in the headquarters, and that doesn't reflect their value to health of women worldwide, and I think we can do much more. But when you go to health systems, you know, doctors tend to be dominant. They often overestimate their contribution to the health of communities and perhaps forget the role of midwives. And also midwifery in some countries is a low status profession. So if you look in South Asia, for example, traditional midwives were from the lowest caste, because they are doing what's seen as a ritually polluted kind of job. And to a certain extent within the health system, that's still the case. And so these professional barriers are a big problem, but you've got to add in the economic barriers as well. They're often badly paid. Many midwives have to take on a second job in order to survive. And then there's the social barriers. Sometimes they're looked down upon, the midwives, by people coming to them. Other times there are abusive relationships. Now, sometimes midwives themselves, under pressure and stress and lack of support, are not necessarily as nice as they should be to their patients, but the vice versa. You get, under high stress situations like a delivery or where something goes wrong, you often find that, midwives are in the firing line as well. And some midwives are at risk of losing their life. I mean, from HIV, for example, if you're in an area where HIV is very common, then you can easily contract it if you just get one finger prick, for example, when you're doing a procedure. So for all those reasons, there's a lot more that we need to do. And this is not just about poor countries. If you look in rich countries today, many, many women are getting unnecessary procedures. Some women need a caesarean section, but in the private sector of many countries, maybe 80, 90% even of women will be getting caesarean sections, which they don't need. They may be getting what's called an episiotomy, where you actually cut the perineum in order to let babies out, and we know that the evidence of that making a difference is not really the case. So, the Lancet series talked about too little, too late for many poor countries, but they also talked about too much, too soon, where women are being over-medicalised in childbirth. And we've known about this a long time, but it's difficult to stop some of that.
Let me ask you about the policy, midwives' role in policy. You mentioned that there are only 2 midwives here at WHO. One, why has it been so hard for midwives to break into those policy positions, or positions that allow them to impact policy? And 2, what kind of difference do you think we would see in policy if there were more midwives with influence?
Well, I mean, firstly, the vast majority of midwives are women. So they're subject to the more general aspects of women being discriminated against and not reaching the highest echelons. I mean, I came before working at WHO from higher education in Britain, where we know that the highest echelons of managers and provosts and chancellors are all, largely male. And there is a glass ceiling. And I think that's true in most parts of the world. On top of that, you've got the hierarchy, the traditional hierarchy of doctor and nurse. And that relationship remains reasonably strong. Parallel systems, not working in teams, resentment. And they're also very practical people. So a lot of midwives go into it because they love the hands-on nature, the relational aspects of care. And so I think maybe midwives are partly, not to blame, but they don't necessarily seek high political office or high managerial office. Starting to change. There are some very impressive midwives now getting into higher levels of organisations, having a say. So I remain optimistic, but I think we do need to work hard to ensure they have a voice. What difference would it make? I think it would make a big difference. I think midwives understand what women need probably better than most others. And even some women who maybe have, had over-medicalised experiences themselves are not necessarily the best advocates for a more balanced approach to childbirth.
Last question. We just launched this report today. You're going to hear very soon some other ideas that we have, one of which is really having a culminating event at the Triennial Congress, ICM Congress in June in Toronto, as you heard earlier. What would you like to say to those midwives gathered about this report? What are your highest aspirations for the Midwives Voices, Midwives Reality report that it would achieve? And Why are you excited about it?
There's a really big opportunity. We are putting together at the moment a global network to improve quality of care for mothers and newborns. And of course, midwives should be central to that process. We're trying to operate at every level. We've got 9 countries interested right now for the first phase, but we hope to enroll many more. We're trying to get partners on board. But to me, a central element of that would be to have midwives from around the world coming together, the solidarity of expertise that we can coordinate here at WHO so that they can feed into that program and, more important, share the learning of what they've done. And I think that would be, if we can do that, I'd be very satisfied, because I think if we can get more midwives into the networks, we're going to deliver effective services and good quality services much more rapidly than if we don't.
Okay, I lied. I have one more question.
Okay.
When you first saw this report, was there anything that you found shocking, or obviously you've been working in this field for a long time, so none of it is necessarily new, but was there any of the findings that you just...
Yeah, I knew that health workers, including midwives, were often exposed to insults, even physical abuse. That doesn't surprise me, because when it's a stressful situation. And so, but we've heard a lot in the last few years about how in some settings midwives can be abusive to their patients. But this report seems to show, and we have to be a bit cautious because it was self-enrolled people, it wasn't a random survey. But nonetheless, about more than a third of the women that filled this questionnaire in said that they had been abused by families. And that brings home they're in the front line of stressful situations, occasionally where babies or even mothers will die. So that's a very tough job. And I think we have to be very sensitive to that. It shocked me, that level, and I think we need to follow up on that and find out some of the reasons and what we can do to help midwives and teams to have a more conducive atmosphere, and which can stop some of these events from happening.
Okay. Anything else you'd like to add?
One other thing. There's a lot of talk about the Sustainable Development Goals, about how we move into a new future with green energy and better hygiene and better water and lower population and more climate friendly. I think midwives are very crucial to all of that, actually. I mean, population and fertility control is an issue that midwives deal with and give advice on. Hygiene is a critically important issue. Many hospitals don't have the hygiene they should, and it's the midwives that can really drive that. But also things like green energy. Many health facilities have no energy supply, and they could be a conduit to, introducing solar or other renewable sources of energy into health facilities. And they're very pivotal members of their community and highly respected by their local community. And I think, therefore, they have a broader remit than just delivering babies.
Great. Thank you. That was great.